All right, chapter 8. It's on joints. Joints are where two bones meet. So when two bones meet, they say they articulate. So articulation is where two or more bones meet. Your joints give skeletal mobility and they help hold the skeleton together. Joints can be classified by movement or by structure. Here we're looking at by movement. So joints that are non-movable, they're referred to as synarthrosis. Joints that are slightly movable are referred to as amphiarthrosis. And then those that you're consciously aware of as you're moving that are freely movable are referred to as diarthrosis. The other way you classify joints is what type tissue you find between the joint. So it's like fibrous tissue where there's no movement. Well, those type of joints you refer to as fibrous. Others, they may have cartilage in between where the two bones meet. They're referred to as cartilaginous joints. And then the ones where pretty much give free movement, you'll find a capsule surrounding the two bones and they provide movement. And those are referred to as synovial joints. All right, fibrous joints. There's three categories or three types of fibrous joints. The ones of the skull, your sutures. So this is a type of fibrous joint. And since it doesn't allow any movement, you may also refer to it as a synarthrosis joint, indicating there's no movement allowed. Syndesmosis, another type of fibrous joint. Basically, you have a ligament, which is connective tissue, connecting two bones. And where the ligament's very short, it represents a type of fibrous joint called a syndesmosis. So an example you could see here, you got your fibula and tibia in the lower leg, and this ligament is so short that it doesn't allow any movement. So this goes under as a fibrous joint, or by movement, you may also say it's a synarthrosis joint, indicating no movement is allowed. All right, let's go back. What does it say here? And then the gomphosis, a third type of fibrous joint. Basically, you have the ligament called the periodontal ligament that secures your teeth into your maxilla or mandible. Those are type of fibrous joints as well. They refer to as gomphoses. So we look at the picture here. You're looking at the gomphoses held together by a periodontal ligament, represents a fibrous joint. All right, so let's see what it says here. Let's go back. Again, joints can be classified by structure or by movement. So here, these are fibrous joints by structure, and they shouldn't allow any movement. So you may also refer to them as synarthrosis, or you could say synarthrotic joints. First example we went over with the sutures, the ones of the skull. They allow for growth during youth. In other words, when you're a newborn, you got these soft spots instead of sutures. They're called fontanelles. And then about after a year, they harden, forming what's called sutures, which shouldn't allow for any movement. So there's a picture of the suture. And just to kind of review these landmarks on sutures, you got the coronal suture going across the crown of the head. You got sagittal suture going down the midline on top of the head. And then here you got, looks like a squamous suture alongside your temple bone. And then the back where the occipital bone meets the parietal bone is lambdoid suture. The other example of the fibrous joint was the short ligament, which is connective tissue. And the shorter it is, the less likely it's going to allow movement. Now, if you got a little bit longer ligament, it may allow for some movement, which it says in this slide here. And the example we saw was between the two bones in the lower leg, the tibia and fibula. And that one should be, let's see here, no movement. So it's a synarthrosis joint. But then you give another example. Let's say the ones in your forearm where you got radius and ulna. there's a joint there, but however there it's diarthrotic, which means it allows for free movement. So for most often, fibrous joints shouldn't allow for any movement, yet there's some exceptions. And then the other third example of the fibrous joint is the periodontal ligament securing your teeth, either in your maxilla or your lower jaw, the mandible. They refer to it as gomphosis. So here's a fibrous joint called the gomphosis. And hopefully your teeth aren't moving, right? So by movement, they shouldn't allow no movement. They should be called synarthrosis joints. All right, cartilaginous joints, just like it sounds, you're going to find cartilage between where the two bones meet. The two examples of cartilaginous joints is synchondrosis and the other one is symphysis. For synchondrosis, the type of cartilage you find where the two bones meet is pretty much going to be hyaline cartilage, which is the most abundant cartilage you find in the body. Think of like in the tip of your nose where it's pliable, there's hyaline cartilage in there. And then for the other type of cartilaginous joint is your symphysis. This is where you find fibrocartilage in between the two bones to absorb compression. So you can start thinking like your disc in between your vertebrae is a symphysis. The padding between your two hip bones, called the pubic symphysis, is a cartilaginous joint. And then there's a padding in your knee. All right. Well, let's just go with those examples there for right now. So let's have a look here. Cartilaginous joints, there are some that don't allow any movement, which means they're synarthrotic. But for the majority, we're going to go with they allow for slight movement. And the term for slight movement is amphiarthrosis. So if you look here where there's no movement and there's cartilage where the bones meet, think of the epiphyseal plate where you're still growing in length, there's live cartilage there, yet there shouldn't be any movement, will be a type of cartilaginous joint called a synchondrosis. And then also where the first rib meets the sternum, there's hyaline cartilage there that shouldn't allow any movement. So that again is a synchondrosis. And again, for the most part, we're going to say cartilaginous joints allow for slight movement, which is the term is amphiarthrosis. But in this picture here, they're immovable. So there are some exceptions. And just kind of review, how can joints be classified by movement? If they're immovable, you say they're synarthrosis, or you could say synarthrotic joints. If they allow for slight movement, then amphiarthrosis. And then for free movement, you refer to them as diarthrosis. And again, that's by movement. If we go by the tissue in between the bones, we got fibrous joints, like the sutures. And then you got cartilaginous joints, like the synchondrosis and symphysis, which we'll finish up in a little bit. And then you got those ones where you've got free movement, and there's a joint capsule called a synovial joint that surrounds the two bones. Therefore, they're synovial joints, are a type of another way to classify joints. All right, let's go back to where we were. We're looking at cartilaginous joints. And again, the example for synchondrosis is where you find hyaline cartilage between where the two bones meet. And again, most cartilaginous joints, we're going to go that they are amphiarthrosis, which means they'll allow for slight movement. Yet there are some exceptions, okay, like in these two pictures here, where there's no movement. And then we have another example of a cartilaginous joint. It's called a symphysis, but the main cartilage between the two bones is going to be fibrocartilage. Yes, granted, you got a little hyaline cartilage at the end of here of your vertebrae, but the disc itself in between, it's fibrocartilage to absorb compression. And then also you have padding in between your coxal bones, which are your hip bones, called the pubic symphysis. That is also a type of cartilaginous joint. Now, the synovial joints, they're all freely movable. That's what they mean by diarthrotic, freely movable. You're going to see a joint capsule, and at the end of the joint, of course, there's going to be hyaline cartilage, and because it meets another bone, they refer to it as articular. And the joint cavity, we just call it synovial joint. There is a portion where the capsule that connects the two bones, there's a fibrous portion there. It's a dense, irregular connective tissue, and that should allow movement in somewhat many directions. And an inner membrane of loose connective tissue called the synovial membrane, which is going to make synovial fluid for lubrication. And the fluid itself is called synovial fluid. And again, it's to reduce friction. In other words, provides lubrication. And there's capillaries in the synovial membrane that's going to provide oxygen, nutrients to the cartilage. If you can recollect, remember, cartilage is avascular. There's no blood vessels. So they got to get their oxygen and nutrients from surrounding tissues where there are blood vessels. So we're looking at a synovial joint where you can see in the middle is the joint cavity, and around the end of the long bone is hyaline cartilage. And then the capsule itself in green here is that inner membrane called the synovial membrane, which is a loose type connective tissue, but there are capillaries in there, and that's going to produce the synovial fluid that's going to provide oxygen and nutrients to the cartilage, which is avascular, located at the end of the long bone. And then also part of the capsule, you got a fibrous portion here of dense, irregular connective tissue. And it happens to just show us here a ligament surrounding the two bones. And a ligament is dense connective tissue, and it connects two bones. So synovial joints, yeah, they do have a capsule. We saw the fibrous portion, right? We saw also synovial membrane within there where there's fluid produced called synovial fluid, providing lubrication. Now, it's telling us here within the joint, yeah, there's some nerves, and in the synovial membrane, there's blood vessels. So nerve fibers are part of the nervous system, right? They're referring to the tail of an axon or axon of a nerve cell. And yeah, so if you got damage to a joint, you're going to feel that. You're going to feel pain. And there's also nervous tissue called receptors to monitor when you're using the joint. So that way you send information to the brain that the joint's being used. And again, within the synovial membrane, that's where you find the blood vessels, which are capillaries that are going to provide oxygen, nutrients, and also make that fluid called synovial fluid, providing lubrication. Similar to synovial membranes that make synovial fluid, you'll find these little sacs called bursar sacs in areas where you don't want friction to occur. And within the bursar sac is synovial fluid. So here it's saying they act as like ball bearings where you want to reduce frictions, maybe where a ligament may be, or where muscles may be rubbing over, particular bone or bone over skin. Anyway, you want to prevent friction. That's what the function of these bursar sacs are. So here, let me give you an idea where we are. This bone on the bottom that's not fully drawn is the humerus, which is the bone in your upper arm. And then up above here is your scapula. And a portion of the scapula is the process here, the acromion process. So this little bursar sac's right below it, and it gets a specific name because of its location. So it's called subacromial bursar sac. Sub, below the process called the acromion process of the scapula. And again, you see it here. It looks like it's going to help prevent friction of this, what is it, a tendon or ligament from rubbing over the bone. Similar to bursar sacs, you have what's called tendon sheets. They basically wrap around tendons, which is a muscle to bone connection, and prevents friction. So let's have a look here. You got a tendon here that would connect your biceps to the bones up here. So you got this sheath called tendon sheath that wraps around it, prevent friction. So they're similar to bursar sacs, but they're wrapped around tendons. So if you think of a joint like your shoulder joint, your hip joint, you may hear some joints sometimes coming out of alignment. What are things that would keep it from coming out? Well, sometimes the bones, they kind of look, one looks like a ball where it's convex, it curves out, and it fits into another bone where it's concave. So the shapes of the bones where they meet play a minor role keeping the joint so that it doesn't come out of its normal alignment. The other thing you could see are ligaments. Ligament is a bone-to-bone connection. It is dense connective tissue, but it's connecting two bones. So if it's around a joint, ligaments tend to help also keep joints from coming out of their alignment. And then the real thing that really keeps the joint from coming out of its alignment are tendons, which is connective tissue connecting a muscle to bone. So if you got tendons around a particular joint, it helps keep the joint more stable because your muscles are never totally relaxed. And since they're not ever totally relaxed, they contract. And as they contract, they're pulling on their attachment sites around the joint, keeping it tight, which is taut. So really, your muscle, the tendons, give it the most stability. And what do they mean by muscle tone? Muscle tone is when a muscle is in a slight state of contraction. It's never totally relaxed. Otherwise, you'd see the muscle go limp. So this slight state of contraction keeps the joint tight. So these are extremely important, it says here, for reinforcing shoulder joints or at the knee and arches of the foot. Okay, now muscles are going to be attached to your bones at least two places, if not more, at least two. Typically, when a muscle contracts, the bone that it's attached to, if the bone is moving, is referred to as the insertion. It's the point of the muscle attaching to the bone that's moving. And we always use a little phrase to help us remember that the insertion always goes toward the origin. So the origin is the point of muscle attached to the bone that is not moving. And then basically that's what it's saying here. And movements can occur in many different planes. Like it may just go along one plane, may go cross, transverse, or may go in multiple planes, like in your shoulder joint, where it's the most freely movable joint. Some synovial joints, like in the wrist, will allow for kind of gliding movement, which is non-axial, they say. Or if the joint allows only in one direction, is uniaxial. Think of like flexing your forearm. It's only going in one plane. Biaxial could be two. You could think of like your fingers, you can bend them, you could twirl them, move them side to side. Biaxial. And then multiaxial are synovial joints where you can move it in many directions or many planes. The best example is in the shoulder. It's a multiaxial joint. And then here, so it says consult table 8.42 for joint names, articulating bones, so forth. And look, we're just going to go with, there's two ways you classify a joint. One is by structure. In other words, what type tissue is found between the two bones. So by structure, you could have a fibrous joint. It may be a cartilaginous joint or a synovial joint. That's by structure. So fibrous joints, like in the sutures here, they have fibrous tissue. Typically, if you classify a joint by movement, if it doesn't allow any movement, we say there's synarthrosis or synarthrotic joints. So notice, fibrous joints, for the most part, are synarthrotic. They don't allow any movement. Cartilaginous joints, basically you have hyaline cartilage where the two bones meet, or it's going to be fibrocartilage. For the most part, they're going to allow for some movement. And the term for slight or some movement is amphiarthrosis, or you say amphiarthrotic. And then for synovial joints, this is basically where most often you're going to see a joint capsule, right, between the two bones that meet, and they allow for free movement. Okay, so ones that allow for free movement are referred to as diarthrotic joints. That's by movement. So here in the vertebrae, some of these are synovial joints to allow for free movement. So classified by structure, your choices are going to be fibrous joints, number one, cartilaginous joints with its hyaline cartilage, or a joint capsule, which is synovial joint. If it's by movement, if they don't allow any movement, That's synarthrosis. Most often, fibrous joints are synarthrotic. Slight movement, they're referred to as amphiarthrosis or amphiarthrotic, and those will be cartilaginous for the most part. And then always for free movement, the term is diarthrosis, which pretty much our synovial joints are always diarthrotic. Okay, let me erase all this. See if I can clear it all out. Okay, so we're not going to go into specifics for each individual joint. You just need to go, like I said, by structure, it's fibrous, cartilaginous, or synovial. By movement, it's no movement, synarthrosis, slight movement, amphiarthrosis, free movement, diarthrosis. And then recognize the different categories of fibrous joints, cartilaginous joints. And then we're going to go over the synovial joints in a little bit. Okay, so for synovial joints, they can allow for movement in different planes. Like in the wrist and ankle, they allow for kind of like a gliding movement. So those type of synovial joints that allow for gliding movements are referred to as plane joints. Flexion, extension, hyperextension, these are all different movements that are provided by synovial joints. And we'll wait till we get to the picture so you can see what type of movement that is for each one of those terms. Okay, yeah, let's look at the pictures so you get an idea. So here, this is a synovial joint in the wrist. They're called plane joints, and the type of movement they allow is called gliding. So going side to side, like if you're waving, is gliding. Flexion, extension, hyperextension. Okay, let's have a look here. So for flexion, typically, if there's an angle between a joint and the angle between the two bones is getting smaller, we call that flexion. So if you think of the chin here and then the sternum, as she bends forward, her head down, the angle between the two is getting smaller. So when the angle gets smaller between the two bones as the movement occurs, that's called flexion. And then let's say if the angle is getting larger, right? So she raises her head back up, the angle's getting larger now, then that's going to be referred to as extension. Now, typically joints don't normally go over 180 degrees, okay? But for the vertebrae, yeah, it looks like you can go over 180. So here you go over a little bit 180, and that's called hyperextension. Let me clear all the drawings before I can move on. So again, flexion is when you got the joint, right? And the two bones, if the angle is getting smaller, it's called flexion. If the angle is getting larger, it's referred to as extension. And in areas of the vertebrae, that's the only area I know that can go over 180, which is hyperextension. So some other examples of flexion, extension. Let's go. So bending forward. Let me get the the drawing marker out. So bending forward, the angle between her upper body and the lower body is getting smaller. So that's flexion. And then as she goes back up, the angle between the upper and lower body is getting larger. That's extension. And then going over 180, a straight line, is called hyperextension. And that's the only synovial joint, at least for me, that I want to hyperextend. Sure wouldn't want that to happen at my elbow or my knee. Otherwise, you'd have some damage. Okay, let's go to the next slide. So here's some other examples: flexion, extension. Bending your knee where the angle between the lower and the upper leg is getting smaller. Flexion. Think of the arm here, the bones in the arm going closer toward the chin. The angle's getting smaller. Flexion. And then here, the angle between the upper and lower leg is getting larger as she moves it forward. Is extension. I don't typically like this example as extension, but they'll go ahead and use that. Typically, like in a lab exam, if they give you flexion extension, we'll have this picture here. All right, let me clear the drawings and close this so we can move to the next slide. All right, some other type movements. If you move a particular body part away from your midline, it's called abduction. Think of abducting like taking away. So abduction. Now, if you were to move a body part toward your midline, you're doing adduction. And then rotating an appendage like your arm in an axial movement around your shoulder joint is called circumduction. Think of a pitcher winding up to throw a ball. So they're doing circumduction, where also when they throw the ball, they're going to have flexion and extension occur. Okay, let's look at some of the examples here. So moving an arm away from the midline of the body. This is the midline, right? So here, that's called abduction. Think of abducting, taken away. And then moving a body part toward midline, back toward, that's called adduction. And then, like I gave you an example of a pitcher winding up to throw a pitch, they're going to do a rotational movement around the shoulder joint. But to throw the ball, you're also going to have flexion extension of the arm. That's called circumduction. Okay, let me close this out so I can go to the next slide. All right, what do we have here? Rotation is the turning of a bone around its own long axis. Okay. So C1 is the first cervical vertebrae. It has a name. Its name is Atlas. Think of the Greek mythology guy that held up the world. That's how it's named. And then C2 allows C1 to rotate so you can move your head either to the side or toward midline. So C2's name is called axis. Looks like you can also have some rotation of your leg. If you bend it a little bit, you can rotate your leg to the side, to laterally, or back toward midline medially. So let's have a look at the examples. So here, C1 is called Atlas, sits on top of C2, and you can rotate your head either laterally to the side as you move your head away from midline, or rotate it medially back toward your midline. Bend your knee a little bit. You can also rotate your leg laterally to the side or medially back toward midline. Okay, some other movements synovial joints will provide is supination, pronation. So let's have a look here. If you can remember from lab worksheet number 1, the anatomical position, person's facing forward, the arms are to the side with the palms facing outward. So there's a joint here called a pivot joint, which is a synovial joint. And the pivot joint allows you to rotate your radius. Your radius articulates with the thumb. And the other bone to the other side is called the ulna. So if the radius has yet to cross over the ulna, in other words, has not crossed it, that's called supination. And then when let's say you need to dribble a basketball, you're going to use that pivot joint here, and you're going to rotate your radius over the ulna. And when you do that, that's called pronation. So that's the example of supination, pronation. Dorsiflexion, plantar flexion. Okay. So let's have a look here. Pointing your toes upward in this movement is called dorsiflexion, and then putting your toes downward, think of planting your foot on the ground. That's how I was told, is called plantar flexion. Inversion, eversion. Okay, we're back still on the foot. And let's see, let me get the markers out again. Turning your foot medially in line to your midline of the body is called inversion. And then throwing it outward laterally away from your midline of the body is called eversion. Protraction, retraction. Look, the only bones that I'm aware of doing protraction, retraction without causing damage is my mandible. Okay. So let me get the marker out again. So throwing your mandible forward is called protraction. Bringing it back into alignment is called retraction. You can also have elevation and depression of the mandible. Elevation means you're raising a body part or a bone, and depression means you're lowering. Think of like elevator, in this case going up, depression going down. So you can also be chewing and your mandible be elevating as it goes up, and then it'd be depressing as it were going down. So here you could see that. And you got a joint here called temporal mandibular joint. It's a synovial joint. So when you raise your mandible, that's elevation. Lowering your mandible is called depression. Now you can have elevation, depression in other body areas. Let's say you shrug your shoulders. So as you shrug your shoulders, they're going up, you're elevating them. And as you relax them, they're depressing, they're going back down. Okay, in your thumb, there's a joint, there's a synovial joint in your thumb. It's called a saddle joint because one of the bones kind of looks like a saddle where it meets the other bone, and it allows you to grasp tools and objects. And the ability to grasp tools and objects is basically touching your fingers with your thumb. And that type of movement is called opposition. All right, so here in the thumb, there's a particular joint. It's a synovial joint. It's called the saddle joint. Allows you to touch your fingers, which allow you to grasp objects, right. So that movement's called opposition as you're touching your fingers. Okay, I think that's the first PowerPoint. We still have another one. Let me get to the other one. Make sure I'm recording here. And make sure, yes, it looks like I am recording. So we're in the second PowerPoint. Again, we're going to look at the different types of synovial joints. In the last scenario, we were looking at the movements that they do. Okay, so these are examples of synovial joints that provide for free movement. So like the ones in the wrist where they do a gliding movement, again, those are referred to as plane joints. Plane joints. Let me get this marker out here. Okay, so plane joints. Let's see here. Multi-axial movement means in many different planes. So here you got a plane synovial joint. This synovial joint is called your ball and socket joint. It's the most freely movable in the shoulder. So it allows movement in many directions. Biaxial would indicate you can move the joint in two directions. So if you think of here where condyles meet your phalanges and the fingers, right? You can flex your fingers, you can extend your fingers. That's one plane. But then you can also do rotation of the fingers as well, kind of twirl them and move them side to side. So that would be two planes. So those type of joints, synovial joints they are, will allow for biaxial movement. Uniaxial, only one direction. So here in your elbow, okay, you can flex your elbow and you can extend your elbow. That's one plane, okay? You can't move your elbow side to side, unless you move your shoulder joint. So joints that only move in one particular plane, like your shoulder, not your shoulder, your elbow here, is allowing for uniaxial movement. Okay, let's go on to the next slide. So here, let me bring out the marker again. Here you've got, let me see, this is your humerus, right? Y'all need to learn your landmarks on bones, just to give you an idea. So that's the humerus, and this here is your ulna and landmarks. So here's called your trochlear notch, and these are condyles. This one's capitulum, this one's trochlea, and it fits in here in this notch so that you can flex your arm as well as extend it. So it's only allowing for one direction. So let me draw an example here. Let's say this is the upper arm and this is the forearm, right? It's only going to either flex, right? The angle's getting smaller, or you can only do flexion and extension. That's it. So it's only in one direction. So that's referred to as uniaxial. I should say one plane. Okay, let me go on to the next slide. Here's our pivot joint. It's a type of synovial joint. And this one allows you to rotate your radius over the ulna to do the movement supination, where the radius has yet to cross the ulna, or pronation. So letter C, there's a joint here called your pivot joint that, let's say you need to dribble a basketball, it's going to allow your radius to go ahead and cross over the ulna. And then when it's not crossed, then it's referred to as supination. But when it's crossed over to dribble a basketball, think of pro basketball players, pronation. Pro is in the word itself, pronation. And look, I'm working with a mouse. I can't write too well here or too quickly. All right, let's get rid of that and let me close that out so we go to the next slide. And these are all types of synovial joints. And this one here, these are condyloid joints. So you got your metacarpals. Should have said metacarpals here. Let me get the pin out again. So these are metacarpals, right? And then after the metacarpals, you got phalanges that make up the bones in the fingers. And you can flex and you can extend these joints, okay? And you can also kind of do a twirling movement, a side-to-side movement. So these are for biaxial movement. Same thing here with the saddle joint, which is also another type of synovial joint. I did mention that one of the bones kind of looks like a horse saddle, right? So there it is. And that allows you to do that movement where you touch your fingers called opposition. And then the most freely movable synovial joint is the ball and socket joint in the shoulder. Now you got two ball and socket joints. One's in the shoulder, the other one's in your hip. But the most freely movable one is in the shoulder. So you can notice you can do abduction, move your arm outward, adduction, right? You can raise your arm up, down. You can do flexion, extension. So you can move it in many planes, right? And therefore it's referred to as multi-axial, as the amount of movements it'll allow. Now, the other ball and socket joint is in the hip. It's not as freely movable as in the shoulder, simply because you got to support the weight of your whole body. So the socket in your hip is going to be a lot deeper, so that way it keeps it from coming out of alignment. Now, one of the things your book mentions, if you're reading, is that this ball and socket joint, they say, think of a golf ball on a tee, where the humerus here, where it's round, represents the golf ball, and the tee, there's not much surface area here in the shoulder to keep that ball and socket joint, in there. So you've got muscles referred to as a rotator cuff that help it keeping it from coming out of alignment. But because there's less surface area here, that allows you for more free movement. All right, the knee joint, it looks like it's the most complex joint of the body. You have a femur patellar joint between the femur and patella, which is a type of synovial joint called a plane joint. So that's going to allow for gliding movement. So as you flex and extend out your knee, you'll feel that patella kind of gliding. What else do we have here? And also in the knee, you're going to be allowed for movement where you could flex your knee and then also extend it. And if you bend the knee a little bit, yeah, you can rotate your leg or your knee partially to the side. And what does it say here? It's the most complex joint of the body. All right. And if we look at a picture here, because of its location, it's also the most susceptible to injury. Think of sports. Think of quarterback, they try to protect them from getting tackled in the areas of the knee so that way it doesn't cause damage. And yeah, because of its location, its complexity, it's most susceptible to damage. All right, let me have a look here. Let's get the pen out. You got some ligaments. Remember, ligaments is connective tissue connecting bone to bone. These are called your cruciate ligaments. Cruce means cross. So they do cross over. One keeps the femur from moving forward, so that's the anterior cruciate ligament. One keeps it from moving backwards, will be the posterior cruciate ligament. Don't forget, tendons and ligaments are connective tissue and they're poorly vascular. So if you have a slight tear, it could heal, but it's going to take a long time because they're poorly vascular. Now, if I tore it, you know, cut it there, that's not going to heal. You need some type of surgery to repair that. Some other things you want to take note here. Here's a fibrocartilage padding called the meniscus to absorb compression in the knee. And then you also have some bursar sacs here to prevent friction, maybe preventing the skin from rubbing over a bone, or maybe a tendon, which is muscle to bone connection. You don't want it rubbing over a bone. So you see some bursar sacs here to prevent friction. And then you're looking at a superior view of the padding in the knee, the fibrocartilage called the meniscus. And just to kind of reiterate, cartilage, overall cartilage, doesn't matter if it's hyaline cartilage, elastic cartilage, and in this case, fibrocartilage. Cartilage is avascular. They're getting oxygen and nutrients from surrounding tissues where there are blood vessels. So if you've damaged cartilage, it's not likely to regenerate when you're an adult. Okay, in this picture, I just want to bring to your attention what keeps a joint from coming out of alignment. In other words, you don't want it to come out of alignment, right? So what keeps it from coming out? Well, we already mentioned the shape of bones as being one thing, where one bone may look round, the other one looks like a socket to help keep it in place. We also mentioned ligaments. Ligament is connecting bone to bone. It is connective tissue. So if it's surrounding a joint, that'll keep it somewhat stable as well. But the main thing that keeps a joint stable so that it does not come out of alignment are tendons. Tendons is connecting a muscle to bone, and it is connective tissue. And why is it the tendon that gives it the most stability? Because your muscles are never totally relaxed. They're always in a slight state of contraction called muscle tone. So if a muscle's contracting, it gets shorter in length. And as the muscle gets shorter in length, it's pulling on its attachment sites. And if it's around the joint and it's pulling on it, see the attachment site around the joint here? This is the joint. It keeps the joint tight as the muscle contracts. So because your muscles are always in a slight state of contraction called muscle tone, that gives your joint the most stability, keeping it from coming out of alignment. Okay, we're still in the knee here. Some things again to kind of bring to your attention. You could see your fibrocartilage padding. It's called the meniscus. You got some ligaments here, which are bone to bone connecting the tissue. It's connective tissue. You got collateral ligaments. Collateral means to the side. If it's to the side, it's lateral collateral ligament. If it's toward the midline, it's called the medial collateral ligament. Yeah, I don't see that where it's labeled. And then you got your cruciate ligaments inside, keeping the femur from moving forward and backward. Here you got a ligament connecting the patella to the tibia called patellar ligament. And again, because of the location of the knee, right, and sports, it's most susceptible to injury. And here it looks like you've torn ligaments. And when you tear a ligament, yeah, that's not going to heal on its own. You need some type of surgery to repair that. If you got a slight tear and you didn't totally rupture it, like in this picture, it would heal, but it'll take a long time. because tendons and ligaments are poorly vascular, which means there's not a lot of blood vessels there. Okay. Okay, the most freely movable joint, which is ball and socket joint, it's in the shoulder. Okay. Because there's a lot of movement allowed in the shoulder joint, there's not much surface area where the humerus meets the scapula to keep it in place. Therefore, you're getting a lot of free movement, right? You can move your shoulder in many directions, your arm, but you're sacrificing stability. So you may often hear a shoulder joint coming out of alignment due to injury. And when you stretch a ligament, you tend to lose some of its strength. So once you have a ligament or tendon stretch, it's more likely to come out. Let's say the joint's more likely to come out again after a first time. We're looking here just to reiterate bursar sacs, these little round sacs of synovial membrane, and in the middle is fluid called synovial fluid, and that's just to reduce friction, keeping like a tendon from rubbing over a bone, or maybe a ligament from rubbing over a bone. If it's wrapped around a tendon specifically, it's called a tendon sheet, again, to reduce friction. Okay, your rotator cuff. We mentioned because the shoulder joint is allowing a lot of movement in many directions. You want to keep it from coming out of alignment. And what helps keep it tight from coming out of alignment are muscles referred to as your rotator cuff. And the muscles that are involved in keeping that joint from coming out of its alignment are listed here for us. You got the subscapularis, uh, below scapularis, below the what? Scapula. Supraspinatus, supra above what? The spine of the scapula. Infraspinatus, well, infra below the spine of the scapula. And then in the area there, the shoulder region as well, there's a muscle there called teres minor. Those muscles there make up what's referred to as your rotator cuff. So if you have a tear in any of the muscles, they refer to as you have torn your rotator cuff. All right, what do we have here? Let's get to the pictures here. So you're looking at your humerus again, meeting the ulna, and that's going to provide flexion, extension there at the shoulder or the elbow region, I should say. And what helps hold it in place, again, tendons, and in this case, in this picture, are ligaments, which are the bone-to-bone connections. Ball and socket joints, the most freely one that's movable is in the shoulder. Here you can see the one in your hip. It's also a ball and socket joint, which is a type of synovial joint. And it allows for a good amount of movement, but not as much as in the shoulder because you got to support the weight of your body. So you don't want that joint coming out of alignment. That's why you got a deeper socket here where you'll meet the femur's head. Okay. And that socket there is called the acetabulum. And again, it also helps keep it in line, right? So it doesn't come out, or ligaments. In this case, you see the ligaments here, and also any tendons that would surround it. So picture ligaments again. All right, there's the joint where your mandible meets the your skull. It's called temporomandibular joint. This is the most, how can I say, most likely joint to come out of alignment. You would think maybe the shoulder because you hear it so often, like in sports, but typically it's this one. It's called the temporomandibular joint. And there's a picture of it right here. And if you can think of the type of movements that you're going to be allowed, you can throw your mandible forward. That's called protraction. Let me see. Okay, they don't have another picture. You can bring it back into alignment. It's called retraction. You can move it side to side. And you can also elevate your mandible as well as depress it. So these are the movements. You can depress your mandible, elevate your mandible. You can gliding, which means move it side to side. And you can protract it and retract it as well. And look at the bottom. It says it's the most easily dislocated joint in the body. So just by yawning incorrectly, it says you can somehow make it come out of alignment. I wouldn't know. I don't want to know. Just leave it at that. Okay, what is a sprain? Sprain is when the ligaments, which is a bone-to-bone connection, are stretched or torn. And again, when it comes to ligaments and tendons, in this case, the ligament, if it's partially torn, it can heal, but it's going to take a while because there's not too many blood vessels there. It's poorly vascular. However, if you completely rupture it, you torn it completely, that ligament's not going to reattach itself. You need some type of surgical repair for that. So think of sprain with a P are when you stretch or tear ligaments, whereas if you got a strain with a T, that's where the tendon is stretched or torn, and the tendon is connecting the muscle to bone. Now, don't forget cartilage. Remember, it's avascular. There's no vessels in cartilage. They're getting their oxygen and nutrients from surrounding tissues. So if cartilage is damaged, it's not likely to regenerate, in adults. So here, due to compression and shear stress, fragments may cause the joint to lock or bind. Cartilage rarely repairs itself because it's avascular. You'll need some type of surgery. And this is a picture of a torn meniscus, which is the fibrocartilage in the knee. Now, I'm no specialist, but my understanding of it's slightly torn, they go in there and maybe do some shaving of the disc here of the meniscus, make it nice and smooth, hopefully again, and that'll take care of it. Now, when a joint does come out of alignment, it's referred to as dislocation or luxation. It can be accompanied by stretching out ligaments, which is a sprain or tendon strain, usually due to some type of injury playing sports. If a joint comes slightly out of alignment, it's referred to as subluxation. Now, anytime you have inflammation of the bursar sacs due to pretty much overuse of a particular joint, remember bursar sacs are these little sacs provide lubrication. So inflammation may be due to overuse. Treatment would be like rest, ice, and if it's severe, let's say you can't move the joint, if you're an athlete, whatnot, and they need to get you back up on the field or wherever you're playing, they may drain the fluid within the joint and then give you some type of steroid injection to reduce the inflammation. Now, if it happens in the tendon sheath, not the tendon, but the tendon sheath that wraps around a tendon and it's inflamed, then it's referred to as tendonitis. And just to bring to your attention, anything that you say tendonitis, as far as we're concerned, means inflammation. So this is inflammation of tendon sheaths, typically again by overuse. Treatment's going to be the same as the bursitis would be what? Rest, ice, and if it's severe enough, maybe some steroid injections to reduce the inflammation. Arthritis. Okay, what do we got here? This is an inflammatory or degenerative disease that damages where the bones meet, the joints. Symptoms, of course, well, in pain, stiffness, swelling of a joint. It may happen within a short period of time. If you ever see this term here, acute, means it happens within a short period of time. Now, if something were to gradually build up over a period of time and kind of get progressively worse, then those are referred to as chronic. Acute forms may be due to like a bacterial infection where, you typically recognize bacteria as foreign, you get rid of it, but then, now your immune system, your white blood cells are seeing something very similar to the bacteria, but it's in your joint and they start attacking your own tissues. Okay. Chronic forms include normal wear and tear of a joint. Look, just over time, you're going to use your joints throughout your lifetime. The normal wear and tear of a joint is referred to as osteoarthritis. Don't get that confused now with osteoporosis. Osteoporosis is where your bones are not as dense over time because over time you take more out of your bones than you put in. And then you got what's called rheumatoid arthritis. And we'll go over that when we get to the slides. But my favorite's gouty arthritis. I mean, not to say I love gouty arthritis, by no means. Trust me, I don't like feeling that. Basically, you accumulate a waste product called uric acid within the joints. And if the uric acid tends to accumulate more, you form crystals, and that causes inflammation in the area. It feels almost like a deep abscess. And this typically happens like in the base of the foot, your toes, the fingers, area where blood flows like the slowest, where the uric acid may start to accumulate. If you know what's causing it, trust me, you'll avoid those things that are causing uric acid, which could be accumulation of like drinking, binge drinking, or eating meat that contain Well, anyway, we'll get to the slides. We'll read it. Let me erase all this here. All right, let's go. Osteoarthritis again is just normal wear and tear as we get older. We're all going to go through some form of osteoarthritis, okay? It typically happens, it says more in women. Well, ladies, at some point in time, you're going to go through menopause. And in menopause, you don't make the estrogen. Making estrogen, whatnot, helps to absorb minerals like calcium, which can play a role in osteoporosis and like in this case, then in osteoarthritis as well. So over time, more cartilage destroyed than replaced, where it's just overworked joints. The bone ends may thicken, enlarge, forming spurs, and that can restrict your movement. Now, treatment doesn't mean it's going to cure it, all right? Treatment would be moderate activity. You don't ever want to totally do nothing. If you don't do anything, you'll take more out than put in. And so you want some moderate activity. You know, you don't want to overwork a joint. Pain relievers, again, that's not going to cure anything. It just kind of keep your mind away from the pain, just treat the symptoms. Like these Caspin creams, I imagine those are like something like icy hot or whatnot. And glucosamine, chondroitin sulfate. Look, the cartilage within the joint's not likely to regenerate, but hey, can't hurt to take supplements. So some glucosamine, chondroitin sulfate looks like it can be used for treatment. Now, the rheumatoid arthritis, what's going on there? You got infected by something, and then your white blood cells are starting to recognize your joint somewhere in the joint similar to what was foreign, and they start attacking it. So it's an autoimmune disease where your own immune system's causing damage. It can typically arise at any time, but usually, later in age. Affects what, 3 times more what women as men. Symptoms include joint pain, swelling, anemia, which is low oxygen carrying capacity, osteoporosis, which is your bones are becoming more brittle, not as thick and dense as you get older. Muscle weakness and cardiovascular problems are signs and symptoms. So what's going on? Your white blood cells are attacking tissues within the joint, and you're going to put scar tissue in its place, which will restrict movement. So the area is going to be inflamed because vessels dilate more. The membrane there, called synovial membrane, that makes synovial fluid, can thicken and form what's called a pannus. Pannus erodes cartilage, scar tissue forms, and the bone ends may actually connect, referring to ankylosis. So picture here of the rheumatoid arthritis. Yeah, that does look kind of painful, huh? Treatment. Well, again, treatment's not going to be quite a cure, is it? Aspirin, well, that's just to treat the pain, right? Long-term use of antibiotics and physical therapy. Progressive treatment, well, you want to reduce inflammation. You want to kind of lower your immune system from being overreactive. So anti-inflammatory drugs, immunosuppressants. Now, the one thing they say up here, antibiotics are for bacteria, okay? So if you're going to lower your immune system a little bit, you don't want to get overwhelmed with infections from bacteria. So that makes sense. You'd be taking some antibiotics as well if you're taking an immunosuppressant that would lower your immune system. Some other drugs I'm not quite aware of says new biological response modified drugs neutralize inflammatory chemicals. I'm thinking more like steroid injections that'll reduce inflammation. Now, my favorite is gouty arthritis, not because I like feeling gout, by no means, trust me. It's accumulation of a waste product called uric acid. Okay. And how does this waste product form? Well, if you remember like DNA, RNA, which are made up of nucleic acids, when you start to accumulate breaking those nucleic acids down, you form urea. And normally, you would normally get rid of it in the urine efficiently. But if you're, let's say, over accumulating this urea, you can form uric acid crystals in the joints. And typically where blood flows the slowest in the far extremities of the body, like your toes, your fingers. So you'll feel inflammation as crystals form, vessels dilate more, causing inflammation. Why is it more common in men? Well, let me think. Who eats more meat that would have nucleic acid? Well, men. Who tends to drink more where you break down alcohol, forming uric acid? Well, men. So men are most often affected. Typically affects, again, joints furthest away from the heart, your fingers, your toes. If untreated, gouty arthritis, the bone ends may fuse and immobilize your joint where you can't move. Trust me, if you're binge drinking whatnot and you know that's what causing it, you'll put down that alcohol. You'll drink plenty of water and allow it to flush out of your system. Okay. Same thing with meats. If you can avoid meats, basically, usually typically occurs when you drink excessively alcohol and you binge drink. You can accumulate the uric acid crystals that way. So treatment, well, yeah, there's some drugs there, but again, you want to drink plenty of water, make sure you're hydrated so things don't remain stagnant in your blood flow, like uric acid, so you can flush it out in your own urinary system and avoid things that may cause uric acid accumulation like meats and alcohol. Lyme disease, it says caused by bacteria transmitted by the bite of ticks. Symptoms, skin rash, flu-like symptoms, foggy thinking, can lead to joint pain and arthritis. Treatment here would be antibiotics. Remember, antibiotics are only good against bacteria. Now, as you develop, it says by embryonic week 8, the joints of the embryo, the synovial joints resemble adult joints. A joint size, shape, flexibility are going to be modified by their use. And again, normal wear and tear is going to occur on the joints as we get older. Ligaments, which are bone-to-bone connections, tendons, muscle-bone connections, will get shorter and weaken. You're more likely over time where you have your disc in between your vertebrae where compression occurs. They may come out of alignment, which is to herniate. And as we get older, again, we're all going to go through some kind of breakdown of our joints called osteoarthritis, just normal wear and tear. What can keep it at bay? Well, moderate exercise, right? Using your joints, but not overusing them, causing damage. And that's the end of the chapter here. You may ask why we didn't do chapter 7. Chapter 7 is all anatomy when it goes for the lab. You're going to be learning landmarks of the bones as well as bone names. But anyway, that's done for us for here for chapter 8. I'll see y'all. Talk to you next time.